Hello, students, and welcome back. So for this part of our lecture, we're going to talk about worksite wellness, particularly some of those worksite or workplace policies and initiatives and programs that have been aimed at increasing the health of employees, of organizational staff, faculty, employees. I'm just using staff and faculty as a very academic way of approaching conversation about jobs. But understanding how workplaces assess the need for a program, how they plan the program, implement it, and evaluate it. So if you've ever taken any kind of health program planning and evaluation, some of what you'll hear today in this particular part of the lecture will sound a little bit familiar. Then we'll talk about some worksite or workplace wellness initiatives that have been effective, and then talk about why do they sometimes not, why do they fail sometimes, or why don't they get the engagement? Why aren't they acceptable? Both based on the worksite perspective as well as the employee perspective. Why don't people take part, as well as why aren't they executed as planned? So with no further ado, we'll keep on keeping on in the lecture. All right, so here's a quote from from the Centers for Disease Control and Prevention that talk about the encouragement of healthy habits and prevention of disease based on worksite wellness programs. These initiatives can include programs, policies, benefits, creating a supportive environment in a workplace for healthy behaviors, links to community resources that promote health and safety for employees. They're really focused on maintaining a healthy workforce. And that's important because it can help lower direct costs of ill health, reduce insurance premiums when people are engaging in healthier behaviors or activities. They can reduce worker compensation claims. They can have a positive effect on indirect costs that seem to be taxing to employers, such as absenteeism, when people miss work because they are not feeling very well, or when they just can't seem to drag themselves out of bed or out of home to go to work. And it can also increase worker productivity. So with no further ado, again, we'll keep on keeping on. So here are some of the ways that workplaces can create strategies that are aimed at promoting health. They can work towards reducing illness and injury. So again, remember when we talked about some of those physical aspects of health, they can plan programs that make it safer to engage in activities and certain behaviors that are necessary to complete a job on the job site. They can be aimed at helping to reduce work-related stress, whether that's like at ASU, we have the Employee Assistance Program, there's counseling, there's services that are for faculty, that faculty and staff can use to address personal issues, relationship in the job issues, such as among management or among employees or employers. There's stress management programs, there are mindfulness and meditation programs, there are a whole host of, at least at ASU, work-related stress-reducing programs. Some jobs help try to support behaviors, healthy behaviors, whether that's nutritional counseling or being more physically active on the job site. Quitting smoking are programs aimed at smoking cessation. At ASU, again, if you complete a certain number of activities and get a certain number of points within this program, you actually are awarded monetarily. You get, I believe, a $200 or up to $200 reward for completing certain activities, which include disease or illness screening or just health screening. We'll call it health screening. Puts again a negative tilt when you put disease screening. And then last but not least, expanding work-related resources and opportunities by trying to provide resources and opportunities that make it easier for employees to stay engaged at the workplace. Employers understand, hopefully they enact this empathy, that people's lives are so much more complicated than just taking care of themselves. Sometimes there are times when people need to take care of other family members, whether that's child whether that's a sick relative, whether that's an older adult. There are also days that are set aside for sick and personal leave, depending on the job. And I really like how your textbook described in chapter 8, how in certain countries like Japan and Germany, there was this real emphasis on always making sure that workers, I think it gave the example of an automobile industry, where there was continual training. Because when employers hired employees, it wasn't just this one-way direct relationship. You do this service and I pay you a salary. It was a commitment to the employee and to the employer. And so therefore employers provided on-the-job skilled training. And let's say that part of their job went to automation. The new training was how to operate in this new aspect of your career and this new duty in your career so that you don't become irrelevant in your job. So you're not just fired because you now lack the skill set that a maybe younger or more newly trained employee could be hired on to do that job. There was this commitment to no, you are capable and we will offer you the training you need to stay with us because this is a working relationship. And then also expanding resources such as adequate wages and salaries and bonuses when bonuses are due. Characteristic, again, of a healthy worksite. So some ways in which worksites can really try to, some of the benefits of health promotion in worksites include reducing healthcare costs. When you look at models of health insurance, especially health insurance that are subsidized by larger organizations, health insurance companies tend to save money and actually make more money when people are paying their premiums, right? The monthly or the yearly amount that you pay, or every 6 months you pay a certain amount, and the workforce remains healthy. What does that mean from a business perspective? That means that people are continually paying in for this business, right? You're paying for your health insurance. And if you're paying out more, if the health insurance company is paying out more, so say like there's like a cluster of cancer, or a lot of people in a workplace are developing a chronic disease which takes a lot of income or a lot of payout for healthcare visits, for medications, and for again for improving the health of the people that have bought into this insurance, they're losing money. So often, health insurance companies will try to pair up with companies to encourage certain behaviors and therefore reduce your premiums. Take, for instance, you might be paying higher premiums if you're a smoker. Why? Because that's a behavior, smoking is one of the behaviors that lead to the most amount of preventable diseases. And so therefore, if you're a smoker, your premiums will be increased. If you're not a smoker, they'll be reduced. So healthcare costs, both from the work site as well as the insurance company perspective, can be, and also the individual perspective, can be reduced if people are living healthier lives. Worksite health programs that are health promotion programs can reduce the amount of days that people miss work when they've got healthier employees. They can help reduce the accidents on the job and how much they might be at risk for, take for instance, being sued for for an employee being injured on site. And then it also helps reduce employee turnover. So if people are quitting left and right, it can be really expensive depending on what the career is to recruit and hire and go through the steps of interviewing and hiring people to be on a job. So if there's a high employee turnover, that's costing a company. Companies don't want this high turnover, right? They want a healthy workforce that shows up and does their job, doesn't get hurt on the job, and stays dedicated to that company. It can also improve the individual employee's health status. It can boost employee morale and job satisfaction. Certain programs can boost social connectedness, can improve mental health and well-being, which again, all contribute to both the physical and mental overall well-being of an employee. can also increase productivity. And when you show that you have a healthy workforce at your organization, that's also a great recruitment strategy. Hey, come work for our company. We offer these additional benefits. I know there are companies that are like Google, where they really try to encourage their employees to spend as much time as possible on the job site. So they have things such as exercise equipment and gyms and showers and transportation vouchers and different benefits that are additional on top of your salary to try to really gain the reputation of being a company you want to work for, right? A highly competitive company that you want to work for, and that also boosts the health and well-being of their employees. So that makes it a more appealing organization to work for. So this model is from the Centers for Disease Control and Prevention, and it really focuses on characteristics of successful programs, how you assess the needs for a program, how you plan and manage what you're going to do in that health program, how you implement it, and then how you evaluate it. Again, if you've taken any kind of health promotion or health program planning course, some of this should seem a little repetitive from what you've seen in those courses. So in the health assessment, you want to get various levels of input to assess what do you need to cover, what do you need to offer in this health program or in this health policy. And you want to get feedback from employees, whether that would be through an employee survey or through interviews or through focus groups. Also, you want to get information from management. You want to try to also collect some objective data, such as the number of days missed, illness and sick leave used, turnover rates, and also performance reports to try to assess what is going on and what can we do to try to improve health at the organizational level. Based on this information, you want to try to create and design a program. By the way, this is when evidence is really helpful. You want to look back to see what's worked in the past. It's great if you're feeling super creative, but at the same time, sometimes there might be innovative approaches to reduce or prevent and control that health problem, but then there might be some tried and true ways of enhancing health and healthcare within your organization. And so kind of going back and looking at some research studies that have shown effectiveness data can be really helpful in creating your plan. You also need to create objectives for your health program. I don't know how many of you guys again have taken a health program planning class, but I'm a fan of SMART objectives that really help you be very specific, create manageable, create action-oriented goals, timely goals, realistic objectives, and what you're going to reach specifically to show that your program did or did not work. And you need to think about these goals in the planning and then again, revisit them during implementation, but really revisit them during evaluation. So in this stage, you're trying to think, exactly how will I know if I'm carrying out the program as I intended to carry it out? That's going to be part of your process evaluation. You're thinking about, what are some immediate outcomes that I will measure to know whether or not my objectives are being met? More so than just acceptability. How will I know that what I'm doing is working? And then also long-term outcome data. Does this have a sustainable impact on employees' health? Yes or no, or maybe, maybe it had sustainable effects for 3 to 6 months, but then a year later you might need a refresher or to carry out that program again. Nevertheless, part of plan 2 is understanding what resources will you need, what kind of human resources, what kind of people will you need, what kind of marketing and messaging will you need? Is there an education component? Is there some type of change in the built environment of your workplace? Is there some type of again, in what way can you create an environment that will be conducive for this policy or program or new resource that you're introducing to be most effective? Next, you implement whatever that program is. Again, the program could be one of nutrition counseling or some kind of mental health related counseling. It could be a new policy, such as we're going to put into place um, a new workplace policy that is aimed at increasing, taking short amount of breaks to, kind of mentally reset and reduce burnout. Maybe it's an organizational policy, such as we're going to create policies that are family friendly, such as we're going to create this particular room or space, and not just a bathroom, for women to be able to breastfeed. We'll create this kind of time to encourage them to be able to pump if they need to pump. We'll give paternity leave because we know that it's both the responsibility of parenting falls both on the mother and the father, or the parents' shoulders. Um, Maybe it's a rollout of a new benefit or incentive program. Maybe there's some type of environmental change that you want to implement to again, try to create a behavior change. And last but not least, you want to evaluate. We planned and we put all this time and resources and funds and energy into creating this program. Did it work? And if it didn't work, why didn't it work? So again, you're going to revisit some of that more objective data, whatever it was that you were trying to use as a benchmark as to be able to discern whether or not your program was working as you planned. You're also going to ask people directly, hey, what did you like about this? What worked and what didn't work? If we were to do this again in the future, what would you change? What would enhance the outcomes? Or, would you just say 2 thumbs up, you guys did a great job, and this was a 100% effective program? By the way, that almost never happens. And in what way did we create a culture of health? This is very much, by the way, a very Robert Wood Johnson Foundation type of term. How did you create this culture of health? How did you create a workplace that really encourages, in all types of manners, a setting which was beneficial for people's well-being? In the midst, you're going to take context into consideration. How large is your company? What are the types of roles that the people in your organization are playing? Or what kind of roles do they play? Where are you located? How much time off do people have? What are their true needs, and what will they be willing to engage with in order to create that healthy behavior change? So again, just to kind of walk through this, first you assess the needs. Based on those needs of both subjective and objective data, you plan a program, and at that time you're planning for evaluation. You implement the program, and then finally you evaluate. And again, that evaluation data is not just left out in the cold to be forgotten or just published in a peer-reviewed journal. Yay, pat ourselves on the back, we got that out for the public. But you use it for the next steps of how you're going to plan the next program, how you're going to assess needs based on this evaluation data for the next iteration of a program. Here are just some examples of workplace interventions: health education, skills training. Skills training can also involve skills training to be more productive on the job. Maybe there's a data analysis, data visualization. Maybe there's a how to work this new technology, how to better resolve conflict in the workplace, how to negotiate a salary increase, how to XYZ. That's part of skills training. Also, there are workplace interventions that are around creating an environment and built environment that is more conducive to health. So there's this really great book that I have called Healing Gotham, and it describes how New York really aimed at increasing the health and well-being, and they were kind of at the forefront of some of the smoking cessation programs that limited smoking at the workplace, limited smoking at certain types of venues. And over time, it was a little bit of a trendsetter in terms of who adopted some smoking cessation, some of these smoking cessation laws and policies. I love when I teach my introduction to public health class, I absolutely love talking about smoking and smoking cessation. You find out some really interesting facts, such as actually one of the, by no means am I in any other way promoting this society, but I put a but there, and the but was because they were the first society to really implement anti-smoking campaigns, was actually Nazi Germany. Again, heinous crimes against humanity. In no way do I want to promote any of the ideals that were promoted. I'm just using the example of some of the first anti-smoking campaigns actually existed within Nazi Germany. They were 20 to 30 years ahead of the United States in terms of research and in terms of carrying out anti-smoking campaigns, because the idea was for this new quote unquote Aryan nation, they wanted the new population that was going to arise from, from basically the Holocaust and from, genocide. They wanted the new population that, again, was the Aryan nation to live the healthiest lives. And that meant you can't smoke. Women absolutely were not allowed to smoke, especially if they were pregnant. Men could not smoke. Men could not smoke and wear their uniform. They weren't supposed to smoke at home. They weren't allowed to smoke in the workplace, because at this, early time, I believe this was 1930s. I'm trying to think of the years of World War II. 1920s. Basically, sorry, history lapsed for a moment there. It wasn't well understood until really the 1960s and 70s in the United States. It wasn't understood that smoking was definitively linked and correlated to respiratory-related health outcomes. Okay, so I digress because I got on a tangent there. But also creating a supportive environment. I already gave you the example of breastfeeding. There are also workplace initiatives that aim at trading out foods in the vending machine for healthier options. There was a really interesting publication by the CDC where they discussed red, yellow, and green options in a vending machine, or certain rows of food were healthier. And as you got either further up or down, or whether it was red, yellow, or green, was related to how healthy were those options. So you could have something that was red, like, whoa, Nelly, don't eat a lot of these, or eat these sparingly, to green, hey, this is one of our healthier options. Another way to create a supportive environment is to encourage physical activity and having on-site physical activity resources, increasing public transportation, which also, so having some kind of voucher, which tends to increase people's physical activity going to and from public transportation, as opposed to relying solely on your personal form of transportation. Say if it's a car, like encouraging walking as personal transportation, fantastic. As in terms of encouraging cycling, that's wonderful, right? You're encouraging physical activity. But if you're driving your car and you're being sedentary, you're not being as active as, say, if you had to, walk to a bus station or walk to a bus stop in order to be a little bit more physically active. And then there are also other monetary incentives. You can create a supportive environment by offering incentives, such as lowering insurance premiums, as previously discussed, or even offering monetary incentives, like I discussed. ASU does that for, healthy workforce, healthy employee program for enacting certain kinds of behaviors. Here were two examples of worksite wellness programs, and they show a little bit of some effectiveness data. So Johnson & Johnson, again, these are a little bit older examples this is supposed to say healthy people. Sorry, it says health people. Johnson & Johnson ran a program where they gave credits to employees who participated in comprehensive physical and mental health programs. They had an on-site gym and a whole variety of programming that were really aimed at increasing mental and physical well-being. And what they found over time is that for every dollar invested, they achieved about $224 saved per employee. So again, reduced healthcare cost, reduced absenteeism, increased productivity. So that's a pretty large benefit to say, I'm going to give you $1, and in return, I'm going to get $224 back, right? That's a pretty great return on investment. Another example is USAA had a Take Care of Your Health program where similarly they had an on-site fitness center. They had programs about making just nutritious choices, helping individuals living with disabilities. What they found is that at the individual level, more participants lost weight, reduced their smoking. Some quit smoking, some just reduced smoking, reduced the amount they were smoking, and participants increased their overall health. And what they found is that over a time period of 3 years, they saved about $105 million. That is crazy. And that's an example of clearly an efficient and an effective worksite wellness program. But worksite wellness programs don't always work. Why? So this is some information that comes from the Canadian Fitness and Lifestyle Research Institute. Well, from the organizational perspective, sometimes there's a lack of funds. Sometimes there's a lack of time to plan these programs. Sometimes there's just inadequate space and facilities. Man, there's just absolutely no way we can have this workout facility. We can't change out the vending machine options. Also, sometimes there's a lack of interest. Just because you bring a horse to water doesn't mean the horse is going to drink, right? So if there's this lack of perceived need or perceived interest, you're going to have a hard time getting employee and employer buy-in. If there's some type of lack of management support, take for instance, you've got these breastfeeding policies, but you've got a manager who gives you the, very colloquial term here, the stank eye. I don't even know. I don't think I should be allowed to use the term stank eye. I am in my mid-30s. That term probably died out a while back, just like the word cray. Both of these should never be said again, but I digress. Let's just say that you've got a manager that's not very friendly towards the idea of, taking these little breaks or times to breastfeed or to pump or to do whatever it is, again, with that being that example, to enact certain behaviors that are supported by a wellness program, well, chances are you're less likely to engage in that behavior. And maybe you also don't know that there are these services that are available at your career. Maybe you're super stressed and you don't realize there are all of these, counseling programs at ASU that are available to students, to faculty, to staff. So if you don't know that these are even available to you, you're not going to use them, which will be a barrier for the progress of any type of wellness program. There are also barriers for employers' participation. If you feel like you don't have time, if you don't have interest, if for some reason you're really sick and you just can't engage in that program, if you feel fatigued on the job, if for some reason that program is going to cost you time or energy or even finances, if you're concerned for your safety, maybe you have a health condition and you think, man, this will really just compromise my well-being. And then again, maybe there's this lack of availability of childcare. This is one extra program that might take place after work and you just can't find, childcare or elder care or some type of support outside of work that would enable you to take part in this program. Again, these are just some classic examples of barriers for these wellness programs.